in Germany. He is one of the renowned cardiologists and founder member of European Bifurcation Society. When we look at the complex coronary disease, then generally we see that where is the lesion from the beginning, from the branches, from the ostial or multiple. He is a specialist in those areas, means complex coronary diseases, complex coronary interventions. And we are very fortunate to share our experiences and his expertise in bifurcation lesions, and see that patient in this area, in the Jammu and Kashmir, they are benefited by these kind of procedures. When we started this department of cardiology, it was used to do angiographies and angioplasties in camps, and doctor used to come here. Though we have grown up to full-fledged center, and we are almost the high-volume intervention procedures, and we do all kind of procedures. There's coronaries, there are pacemakers, they are peripherals, they are involving devices for heart failure. And it's a great day for us that Ferenc has chosen our center to be with us. He was in Bombay. He's going back to Delhi a day after. And we have done 4-5 cases since morning. We have shared 2 cases with him also. Till evening, we are going to do almost 10 to 15 cases. Let's see. And depending on the type of anatomy and lesions. So this is what it is. If you want me to speak in Hindi, we can speak in Hindi also. And बड़ा अच्छा दिन है मेरे लिए, possibly जम्मू के लोगों के लिए, कि डॉक्टर Miroslav Ferenc, he is from Germany. He is director intervention cardiology and one of the respected and a clinician who has a wide kind of experiences. जब भी हार्ट की बीमारियां होती हैं तो हम ये लोग देखते हैं कि किस किस्म की बीमारियां हैं, चाहे वो आर्टरीज की बिगनिंग में हो, आर्टरीज की बाइफरकेशन में हो, और मल्टीपल ब्लॉकेड्स हों आर्टरीज में, तो उनको करेक्ट करने का क्या तरीका होता है. जनरली 2 एस्पेक्ट हैं कार्डियोलॉजी के, एक तो प्रिवेंशन है और दूसरा इंटरवेंशन है. हम लोग जो आज इंटरवेंशन की बात कर रहे हैं, ही इज़ लार्जर एक्सपीरियंस एज फार एज बाइफरकेशंस आर कंसर्न्ड एंड कॉम्प्लेक्स कॉर्नरीज. मकसद तो यही होता है वर्कशॉप्स का कि एक दूसरे से सीखें और यहाँ के जो लोग हैं, खासकर जम्मू के लोग, उनको बेनिफिट हो फ्रॉम दीज काइंड ऑफ प्रोसीजर्स. So that is what the Department of Cardiology is doing for so many years, and we are fortunate that he is with us. And आज शाम तक तकरीबन 3-4 केसेस हमने किए हैं अभी तक. His flight was little bit delayed. शाम तक जितने भी केसेस हैं 10 से 15 लाइन अप हैं, देखेंगे कितने कर सकते हैं हम लोग. तो एक इस रीजन में लोगों को काफ़ी सा बेनिफिट हो रहा है इस किस्म के प्रोसीजर जो यहाँ आगे नहीं होते थे. कार्डियोलॉजी में तो हम लोग हर किस्म के प्रोसीजर करते हैं, चाहे वो कार्नोरीज हैं, चाहे वो पेसमेकर्स हैं, चाहे डिवाइसेस हैं, हार्ट फेलियर या पेरिफेरल वैस्कुलर डिजीज़. और ये बड़ा अच्छा सा दिन है कि वी आर शेयरिंग आवर काइंड ऑफ एक्सपर्टाइज विद हिज काइंड ऑफ एक्सपर्टाइज. और ये भी एक अपनी फील्ड में स्पेशलिस्ट हैं, ये जर्मनी में बहुत बड़े डॉक्टर हैं, और ही इज़ ए डायरेक्टर इन वन ऑफ हिज सेंटर एट प्लेस नोन एज फ्रीबर्ग इन Bad Kronzis end. Yes. So very nice. Welcome you, and you can speak to them if you there's some kind of questions. आप बोलिए और मैं.
Just share your experience when you are doing 2 cases here. What is your experience here?
Yeah, maybe first of all, thank you for invitation to Jammu. I'm first time here. And before COVID, I was, I think, one time in Srinagar for some workshops. So a wonderful area here in one of the best areas probably in Asia, and very similar to European Alps. I'm director of the cath lab at the University Heart Center Freiburg, Bad Krozingen, and this is the largest center for interventional cardiology in Germany. So we do around 3,000 procedures, coronary procedures, and implant around 10,000 stents per year in our patients. And it means in majority of cases, our patients today have a very diffuse disease. There is no one stenosis, no one blockage. There are 2, 3. It's not only 5 millimeters stenosis blockage, it's a 50 millimeters blockage. And we just have done a case for a young lady with implantation of a very special, unique stand from Maryland, India. And we could just cover very long blockage with one stand. And what I always do and what I always recommend to my colleagues is if you implant the stand, must be improved using some additional balloon dilatations to achieve perfect result. What I heard from you, so at the moment you don't have a machine for imaging, but you are on the way to have it. How the stance is working, how it looks, and do we have to perform some kind of correctures? And I think we do here today very good job, because all important staff is available here, and I think this is one very important this is one very important information to patients here in this region. They can be treated very elegant, very nicely. There is maybe some option to improve results in patients with extremely complex anatomy, and you will see, this is what we see in Europe, our patients are going to be older and older, and the blockage is more and more difficult to treat. And one of the options to treat such patients is also to use of different plug debulking techniques. So there is a rotablator, orbital atherectomy, shockwave balloon, etc., on top. And I think this is also something what you should in next 1 to 3 years try to implement in this center, because then you will have very, very bright spectrum, to treat really definitely everybody. So we will go ahead today to treat, I think, 10 more patients I'm quite sure we will treat these patients perfect without complications. And you should know to avoid complications is very, very important part of the procedure. You have to do safe procedure and not damage the patient, right? And if something happens, you need to background some support, some special devices, and even heart surgery. And as you mentioned, in this center you have cardiac surgery, so patients can be safe. If something doesn't work, there is still one more option to stabilize our patients with help of our cardiac surgery guys.
First of all, we welcome you here in Jammu, and I would really like to ask that according to a study, it's always found that there are a lot of heartbreak cases. I'm sorry to say, I will just repeat it. A lot of heart attack cases are seen more in men rather than women. What is your experience about it? What would you like to comment on it?
Yeah, sorry. The point is, men have have some genetic problems. There's a gender-specific relation between coronary heart disease and gender. Women has, and you are happy, up to menopause, you have really very good hormonal protection. So if you
menopause.
Till menopause.
Okay.
So if you don't smoke, if you do sport, if you take care for your health, then you will be. Normally, you will not get acute MI, myocardial infarction. But the problem is, in general, after menopause, then your risk increase, particularly if you have diabetes, if you have more risk factors like hypertension, etc. And I think the men are smokers much more frequently. I don't know who of you is smoker here, but this is definitely one of the highest risk factors. And particularly if you are diabetic patients and if you're a smoker, that is slow suicide, so please stop. I think everything must be done to prevent such heart attacks, and this is a cooperation work for general practitioners, with cardiologists, etc. And some patients, if they have such risk constellation, they should even go for some checks to cardiologists, to get some exercise tests, echo test, blood tests, and then you can see what can you do for best prevention, Best way, best treatment is to prevent. And if something happened, then you have to go to a center with all these technical options to perform high quality treatment in coronaries, and expertise of doctors is I think very crucial.
Thank you so much.
We appreciate the experience you shared with us. So, how much time you are going to spend in Jammu, sir?
Sorry, how?
How much time are you going to spend in Jammu?
Oh my God! So we had today morning flight delay from Mumbai, so I was flying over Leh. Wonderful area, so I could really first time see Himalaya, and we just do today probably in the next 5-6 hours cases, and then there's probably one nice dinner, and tomorrow morning I have to fly to New Delhi. There is some one meeting is with the Merrill company in I think Apollo, and Friday in Medanta, New Delhi.
Again, so do you have plans to come again in Jammu?
I hope so. We will see.
Definitely
But
He's
it's
a
lovely area,
he's
and
a-
yes, I
He's a
think
dear teacher and friend, and yes, we kind of
Yes.
bond we share with him. We keep on reciprocating, and his coming to this place is always encouraging and will benefit. Is going to give rise to benefit to some kind of patients which are having a complex kind of anatomy, and idea of doing this kind of workshop is एक दूसरे के साथ शेयर करने का तरीका, एक्सपर्टाइज जो कि जर्मनी में करते हैं, जो हिंदुस्तान में हो रही है, दोनों में क्या अंतर है, और एक एक्सपेंशन है नॉलेज का, और वी ऑलवेज गेट लर्निंग फ्रॉम हिम, एंड वी विल कीप ऑन लर्निंग फ्रॉम हिम इन फ्यूचर आल्सो. और हमारा ये रहेगा, इनसे भी रिक्वेस्ट फिर रहेगा कि नेक्स्ट ईयर में फिर आएंगे, फिर वी लाइन अप फिर केसेस विच आर वेरी डिफिकल्ट टू ट्रीट, एंड जनरली जितने केसेस हम लोग करते हैं जो ये कम्प्लेक्स की बात करते हैं, उन लोगों में ज़्यादा सर्जरी की ज़रूरत होती है. तो कुछ लोग ऐसे हैं जो दोज हु आर नॉट विलिंग टू गो फॉर ए सर्जरी, या उनकी कुछ को मॉर्बिड डिजीज ऐसी होती हैं कि खाली सर्जरी इज नॉट वेरी एसेंशियल और रिक्वायर्ड फॉर देम, और द फैमिली इज नॉट विलिंग और पेशेंट इज नॉट विलिंग. उन लोगों में काफ़ी सा बेनिफिट होता है. रूटीन तो प्रोसीजर करते हैं. इनके सेंटर का वॉल्यूम और हमारे सेंटर का वॉल्यूम दोनों में बहुत अंतर है, बहुत फ़र्क है. हम भी एक हाई वॉल्यूम सेंटर की तरफ पहुंच चुके हैं. हमारा भी नंबर जो है वो प्रोसीजर्स का बहुत बड़ा है जम्मू में, वो किसी भी सेंटर इंटरनेशनल लेवल के जो भी सेंटर है उससे कंपैरिजन के में है. बाकी प्रिवेंशन एस्पेक्ट डिपार्टमेंट ऑफ कार्डियोलॉजी हम लोग करते ही हैं. हम लोग हर संडे को कैंप करते हैं और लोगों को अवेयर करते हैं कि ये डायबिटीज़ का ध्यान रखिए, ब्लड प्रेशर का ध्यान रखिए, स्मोक से दूर रहिए, अपने लिपिड्स का ध्यान रखिए, चलने की कोशिश करिए, आइडियल वेट सा मेंटेन करिए, और स्ट्रेस के लेवल को कम करिए. और जिन लोगों में दिक्कत होती है, चाहे वो सांस की दिक्कत है, छाती में दर्द होता है, घुटन होती है, चलने में दिक्कत होती है, तो वो लोग इन्वेस्टिगेट कराने की कोशिश करिए. जैसे फ्रेंक ने बताया कि आगे की टेस्ट हैं, जैसे TMT है, एंजियो है, इको है, वो सारे हम लोग करते हैं रूटीनली. डिपार्टमेंट ऑफ कार्डियोलॉजी डूइंग इट. और आपकी सपोर्ट से ये एक अवेयरनेस प्रोग्राम लोगों तक और जाने की कोशिश करें कि हम लोग कैसा खाना खाएं, ज़िंदगी में कौन सी चीज़ें हम अवॉइड करें और किन चीज़ों को कैसे ट्रीट कर सकते हैं। ये एक मकसद है वर्कशॉप्स करने का और इंटरेक्शन करने का। थैंक यू।